Metro Pacific Health is the largest private hospital network in the country with 27 hospitals nationwide, including Makati Medical Center and Cardinal Santos Medical Center. This year, they plan to expand and acquire more hospitals, strengthening their commitment to deliver quality healthcare services to more Filipinos. And to delve deeper into this, we have Dr. Harish Pillai, the Group Executive Officer of Metro Pacific Health. He brings 26 years of experience in hospital management across Asia, the Middle East, and North America regions. Welcome to The Big Story, Dr. Harish.
Thank you. Thank you for having me. Good evening.
Well, a hot issue we just were discussing with the former Associate Justice of the Supreme Court was the PhilHealth funds and how our countrymen have to spend out of pocket when they fall ill because of deficiencies in the state, in the way the state has administered its universal health. So how is MPH going to help fill the void?
Well, we are truly inspired by our chairman's vision. MVP, as we fondly call him, he's a very proud Filipino, and he has given us the mandate that through this entity, Metro Pacific Health, we have to improve accessibility to all Filipinos throughout the country, improve affordability, and ensure a minimum quality of care. So that's really the core essence of our strategy in whatever we do. And yes, private sector, not just Metro Pacific Health, but I guess all private practitioners and providers in the country, we are partners to the tremendous work being done by the public sector. So we are shoulder by shoulder with the public sector colleagues to ensure that there is some degree of equity for healthcare provision in the country.
Dr. Harish, I was curious about your expansion plans. We've been familiar, of course, with MPH's acquisitions of some of the top hospitals around the country for a while now. But next year, I heard you plan to expand and acquire more. I, of course, am curious to know whether these will be, again, top-tier hospitals, or are we looking at something a little bit more different, something a little bit more universal, I suppose, is the word I'm looking for.
So if you look right now with 27 hospitals already in the country, we have a nice position in various important geographies, whether it's National Capital Region, where some of the best known brands, or as the regulator, the Department of Health calls it, the level 3 hospitals. We have a sizable representation in our portfolio. And if you go to Vismin area, we have presence in areas like Bacolod, Bohol. We have already 6 units across Mindanao. So the way we are looking at the country is that because of the massive investments in infrastructure, we see that there is a decentralized approach towards urbanization. More urban clusters are coming up, and usually when you have young families migrating to these urban clusters, the big demand is for social services, education and healthcare. We usually look at clusters where you have a rich pool of human resources, mainly doctors and nurses, for example. Is there space for expansion if it's a brownfield project? And that's how typically we take an acquisition decision. But yes, we remain confident that by Christmas this year, the family would be bigger.
And Dr. Harish, apart from your expansion plans, tell us about some of the key advancements that you're planning to implement to improve patient care in terms of facilities and technology.
So this again, I have to go back to our chairman's mandate, right? He often tells us that why are Filipinos, especially those who can afford, why are they traveling to Singapore for healthcare, especially in our region? Philippines is blessed with a rich plethora of human resources. Like because of the curriculum design of training of doctors and nurses, you're really world class. When you look at from a global perspective, the Filipino nurse is a brand ambassador of the country. And most of the doctors, the skill sets they possess are truly unbeatable. So what we are trying to do from the private sector perspective is to create an ecosystem where complex services, which is really the need of the country, can be made more affordable and accessible through our network. So some examples is the one of the largest hospitals in the network, Makati Medical Center, they have really gone about really pushing ahead with minimal access and robotic surgery program. So they have already installed the state-of-the-art Da Vinci robotic system, which is already showing tremendous impact on patient care services, for example, in specialties such as urology, gynecology. So a lot of work is being done. On the other end, if you go to the south, Asian Hospital will be the first in the country to install a cyber knife, which is a cutting edge technology where oncology, radiotherapy is concerned. If you look at an institution like Cardinal Santos, they have something unique called an O-arm, which facilitates spinal surgery in a safe environment. So we look at the needs of our local communities and the clinical mix in each of our hospitals when we make these decisions. So this is one aspect which is expected of a hospital to be always at the cutting edge where medical technology is concerned. But some interesting thing when you look at network wide is to enable patients wherever they are to be part of a collective ecosystem. So this is an ambitious project which we have embarked, what we call as the digital transformation of the entire network, is to connect the dots and to give a unique patient ID. So wherever you are in the country, if you have a Metro Pacific network hospital available, you should be able to access that without carrying your paper files in a physical form, because it's all easily accessible through digital. So that's an exciting transformation project which we are embarking right now.
Dr. Harish, in line with the digital transformation that you're about to undertake or in the process of, I just wanted to check in because after COVID or during COVID, telemedicine became a huge thing. And I know the Metro Pacific Health Group also invested big into that, remote patient care, telemetry. Is that still being pursued? Is that still a thing? And is it really actually helping to bridge all these gaps in terms of accessibility?
So, many times, our chairman MVP is a true visionary. Especially, he's much ahead of the rest of us, where his passion for the digital ecosystem is all about. He's been talking about AI, I guess, for the past 5-6 years. So MWell, which is a critical component of the Metro Pacific, the greater Metro Pacific environment, is basically the app technology to connect the consumer, in this case the patient, with the provider, who could be a clinician or let's say a hospital setup. So yes, there is a big focus in investing in more digital technologies to connect the dots and to, like I said, the whole approach is improving accessibility. So we call this the brick and click model of healthcare, where your traditional infrastructure, which is brick and mortar, and technology, which is the click, it all interfaces seamlessly.
I like that.
But Dr. Harish, a crisis is being faced by the country in terms of losing our health professionals to hospitals abroad. How do you intend to keep them here? What opportunities are there for growth in this ecosystem that you have?
So I guess this many parts of Asia have gone through this aspect of brain drain. So there are one school of thought which says that, hey, this is a brain drain, but the other aspect is it could also be looked at as a brain trust. The greatest gift for Philippines is its people, the human capital, which is so rich and diverse in this country, and your OFWs. Imagine that this is a unique country which can reach out to highly trained experts in most of the developed countries in the world. So there is a lot of reverse knowledge transfer and mentorship happening from the healthcare OFWs overseas to the domestic sector. But on the other side, infrastructure investments by groups like Metro Pacific is acting as a talent magnet for reversing the brain drain. And we have a lot of examples of highly qualified doctors and nurses coming back home because the infra here is on par, if not better than the most advanced countries. So I think this is a sure signpost of things to come.
And Dr. Harish, well, I just wanted to go back to a point you made earlier that a lot of Filipinos are going to Singapore to seek healthcare treatment, especially for cancer. And unfortunately, that's quite costly also for them. So are cancer care centers plans like that in the pipeline right now for you? And any partnerships in place to make high-quality healthcare affordable for Filipinos?
So I see something remarkable which has happened over the past 2 years is the changes being happening, at least what is being put into effect by PhilHealth, the national payer. We can see that there is a singular increase in coverage rates. When you talked about cancer care, which is rather expensive, PhilHealth has increased the coverage for cancer care, whether it's daycare, chemo infusions, for radiotherapy. So when PhilHealth steps in, the affordability quotient increases and hence accessibility improves. So earlier, let's say there were large queues and waiting lists in public facilities. Now, because PhilHealth has stepped in, I think a lot of patient populations are able to access high quality care in the private sector. So this is a big change what we are seeing. And of course, as a private entity, we always look at responding to the needs of a community. So yes, there is a significant investments in multi-speciality centers where oncology would be a flagship center of excellence. So yes, that is definitely happening.
I guess one last question for me, Dr. Harish. I'm curious how the strategy is, to maintain the same quality of service across all the different hospitals from Luzon to Mindanao. A lot of these were acquisitions, right? So in the beginning, they all kind of maintain their own characters, their own personalities. But over time, how would you say that there's cohesion and quality control across the board? And how do you make sure that it stays that way?
Well, doctors, wherever they're all the same, and patients, as you know, nobody comes out of choice to a hospital. It's out of necessity. You might go for something else to a hotel, but when you come to a hospital, it's always some sort of pain, either physical or mental pain. As healthcare workers, we feel it's a blessing and a privilege to be of service to humanity. And these principles of basic empathy is something which binds all of us in the network. Of course, we have invested quite a bit on frontline staff, whether it's your non-clinical staff, your nurses, your doctors, your technician, and the thing which is a great blessing in Philippines is that a Filipino I believe, has got a core DNA of empathy built in. It makes service harmonization in healthcare so much easier. I have seen, I've heard a lot of anecdotes that even in the United States, patients in the ICU demand for a Filipino nurse to be at their bedside rather than of any other nationality. And here we are within our own country, blessed with all this naturally empathetic healthcare workers. It makes our job so much easier. So yes, there is a lot of management cohesion behind it. A lot of structured programs are going on, but half the battle is already won. Thanks to the natural resources and the cultural strength which we already have.
Indeed. Thank you so much for joining us tonight, Dr. Harish Pillai, Group CEO of Metro Pacific Health.